I was saying earlier, we will be, I've just started the recording for the session, so we're recording it, and the recording and the presentation will be made available to everybody else afterwards. It will actually be put onto our futures workspace, where you'll also find lots of other resources as well. So if you're not already a member of that, at the end of the session, I will put a link in the chat, and I'll also email it out to everybody as well. Unfortunately, we're not able to email the recording and the presentation because it would just be too big for people's mailboxes. So yes, you can access that on our Futures workspace, because that's just a place that we obviously use to store a lot of information that could be helpful within the learning disabilities and autism space. We have run a number of events this year, and Your Voice, I don't know, some of you might have actually joined the session that we did, I think it was a couple of months ago, and we're planning a couple more as well. So please do join the workspace because it's a really good place to actually find information.
Thanks,
So
Angela. Thank you.
okay.
And if we don't have as much time for question and answers at the end, if you pop them in the chat, we'll make sure that Sammy, Rosie, and Sophie answer them, and we can email them out to people if that's all right. It looks like Sammy's here now. And Sophie. I'll hand back over to you, Sophie.
I'm here now. I'm really sorry. I was my computer decided to crash out just as I logged on. So as Fiona said a couple of minutes ago now, welcome to our webinar. This is adapting health care services to autistic people. So next slide. So we are Your Voice is a network of neurodiverse self-advocates across the Southwest. Our network meetings provide a safe place for autistic people who don't have a learning disability, but also may be neurodivergent in other ways, to share experiences. And my computer is still playing up. I'm really sorry. Oh. So, there it is. And to share experiences and discuss the issues that are important to them. So, I'll just introduce myself. I'm Sammy. I'm the autistic project worker. I'm autistic and I'm partially sighted, which was part of the problem with the computer there. I need a certain program on my computer to be able to see. I help with the admin side of the project, but also I chair and facilitate the network meetings themselves, making sure that the autistic voice is always heard in things like this. And in my spare time, I like sport and music, Western shows, and Comic Cons. So, Sophie, do you want to introduce yourself?
So I'm Sophie. So I'm fairly new to this project. I'm the new Your Voice project coordinator. So I'm really keen to work with the community of South Advocates in the Southwest and to help feedback their lived experiences to the NHS and try to promote some positive change in healthcare. So I'm based in Cheltenham and I live with my little dog Finn and my tortoise Timmy, and I'm a keen gardener and love walking in the countryside.
So we're just going to do some housekeeping, and we want everybody to be comfortable. As Liana said, if you could keep yourselves on mute. And there will be a dedicated Q&A at the end, hopefully. But if not, if you can leave your questions in the chat box. And this will be monitored by members of the NHS. So we'll just make sure that we've got those questions for you. So let's start with the important question of how important is accessibility really? So accessibility is the care given to include the needs of people with disabilities in healthcare. Accessibility is one of the key factors in making healthcare more personalised and adapted to autistic people. It's often the first step in enabling access. Making adjustments for disabled people often makes things better for all patients and can make things more efficient. So one of the main ways that things are made more accessible is by reasonable adjustments. And we've got a picture of a cat there because often autistic people are compared to cats. I know that's a little bit of an outdated way of thinking, but the communication styles, often autistic people just want to curl up to a little ball. Social skills, cats can be quite lonely or wanting their own solitude, as autistic people can. Sensory overload, and of social differences. So one of our network members told us that they took their cat to the vets, and they were given a nice little waiting room away from the dogs that could cause the cat anxiety. And they said, you know, as we all did, that they wished that the same attitude was taken to them at the GP surgery. So we make reasonable adjustments for our pets, so why can't we do it for humans? So this slide is just sort of asking that question. If the little things that we can make, little things can make a big difference to autistic people. We're not asking for the world. They can really make a difference. They may be the thing that makes it possible for an autistic person to even attend an appointment. These reasonable adjustments should always be person-centered and tailored to the individuals, and what works for one autistic neurodiverse person might not work for all of them. Many of our networks said they didn't know how to ask for a reasonable adjustment, and they might know what their needs are, but not what is reasonable to ask for.
Okay, so this next slide is, we just wanted to talk about energy accounting. So anyone who joined the last webinar may have already heard this, but we thought as a refresher, we just wanted to talk about how many neurodiverse people, one of the ways that keeps them well is some form of energy accounting. So some daily tasks can take up a lot of energy to complete. And that might be because they cause more stress and anxiety to that person. And then there'll be other things that will give you energy, such as, you know, resting and engaging with something that will give you some kind of form of autistic joy, which varies according to the individual. So some people may have heard of spoon theory. So most energy accounting uses a way of measuring each task through a unit of energy, and the most common unit of energy is spoons. And autistic people can find this to be a really good way of making sure that they keep some sort of balance in their day-to-day lives. And energy accounting can help an autistic person to have a plan for when life is really busy or challenging and when energy levels may be a bit lower. And it can just help that person to sort of manage their day-to-day lives in that way.
So we got here, so one of our networks said they'd love a reasonable adjustment menu. So we got here what isn't generally offered as a healthcare clinic. So the standard letters that are not adapted, well, that's going to take a spoon. Having jargon that we don't understand or nobody understands, particularly when it's sent in text messages, it all costs energy. So we got that little menu there. And then we've got a receipt of just going to one healthcare appointment. And say that you've got a daily allowance of 15 spoons and you've taken up 13 spoons just trying to get to this healthcare appointment. You've only got 2 spoons then for the rest of the day. And that is things like eating, getting home. So it's really important. There are the menus, these menus therefore show not having reasonable adjustments during that healthcare appointment can have an effect on an autistic person's well-being. Autistic people can use spoons to measure their energy levels. And this menu just gives an example of what might happen in a healthcare assessment, which can cost those autistic people a daily allowance of energy to tolerance and tolerance to stimuli and well-being. But it's not all bad. So again, here you go. Here are our nice little menu of our little reasonable adjustments. So we've got our plain English letters, and I hope you can see the difference in how much that the difference in levels of spoon it takes. Reasonable adjustments can improve an autistic person's access to healthcare. Here are some examples of a reasonable adjustment that autistic people could ask for. When speaking to our network, as I said, the neurodivergent community are unsure of reasonable adjustments and what they can ask for. So menus like this, and knowing just some standard reasonable adjustments can really help.
And then the next thing we wanted to mention was what's known as the reasonable adjustments flag. So this is a digital marker that is put on a patient's NHS record, which can help identify some key information for healthcare workers who are supporting patients with disabilities. So this adjustment flag will contain basic information about a patient and key adjustments and relevant details to support that person. And that information therefore can help the healthcare worker to support that person in the best way appropriate to that individual. And the flag has been developed to comply with the Equality Act of 2010.
So one of the most helpful ways that adjustments can be made and recorded is a healthcare or neurodiversity passport. This is a document designed to help neurodivergent people communicate their needs to healthcare professionals and care professionals. The passport includes questions about sensory processing and communication preferences, as well as asking what might help somebody feel less anxious or overwhelmed. and it provides information on how professionals can help support neurodiverse people to access the healthcare. It's a single document that can be used across health and social care. So here we have an example of one that is from the Independent Trust here in Gloucestershire. I know Dorset also have something similar that they're working with their young people on. So you can see the characteristics of my autism, what it's like being with others in busy places, in bright lights, things that may cause issues, how you communicate, things that affect the communication, like tapping on a keyboard, being touched, not you liking eye contact, and also, here ways to help with the to help avoid being distressed, which is good. Yeah, and other difficulties that might affect my ability to do certain tasks. So this is, like I say, from the Independent Trust in Gloucestershire, but there are other versions around. I know National Autistic Society have one, and Dorset perhaps have one too.
So this next slide is what we've called an appointment walkthrough. So it's suggestions that have come through from the network in the Southwest of ideas that might just make health appointments more accessible. So I'll just run through them now. So reminder text for appointments can be really, really helpful. Like Sammy said earlier, having a quiet waiting area or an accessible space can just help reduce the amount of stress that an appointment can create if you're in a busy space. That can become quite overwhelming. Having a written plan of action following an appointment, so that everything that was said during that appointment is written down, can just help someone to remember what was said during the appointment. And easy read communication. Having scheduled appointments, because a few people in the network said that if something is left open-ended, like a drop-in session, that can feel really inaccessible. So having a scheduled appointment is helpful. Also having an online booking system, rather than having to call up to make the appointment, can make the system far more accessible. And having written communication by text or messaging on the NHS app, because again, a few people have said that it's so much easier to write things down rather than trying to explain things verbally. It could just be easier to sort of process what someone is trying to say if they're able to write it down and communicate that with their healthcare worker. Having a single point of contact, so that the person is not having to repeat the same story over and over. As Sammy mentioned, health passports, so that all that reasonable adjustments and all the information about that person is there and it's ready to go. So the healthcare worker can see that and just see what they can do to support that person for the appointment. Having appointments at quieter times when there's not so many other people around. So maybe earlier in the morning or later on in the afternoon when it's a bit quieter. And ideally being able to have a longer appointment if needs be, just to reduce the stress levels that a short appointment can cause. So the next thing we wanted to talk about was mental health appointment processing. So, I mean, talking about mental health can be really draining, especially for someone who is autistic. And filtering through thoughts and emotions can be really triggering, especially when you don't have any closure after an appointment. Someone in our network described their brain like a colander. So after closure from an appointment, thoughts, emotions, and information were able to filter through the holes. But without closure after an appointment, those holes can get blocked, and the emotions, thoughts, and information can't pass through. So it kind of gets stuck. And this can really lead to sensory overload, meltdowns, and mental health worsening. So we've got a voice recording here from someone in our network just explaining what this slide is trying to represent here. And then this next slide is just another visual representation of what we're trying to explain here. So you can see how the incoming thoughts in the second picture, if they can't drain through, then it all gets stuck there, and that can really lead to overwhelm. Whereas if they're able to drain through, then that person is able to process what's going on and hopefully avoid that sensory overload.
So we just got some coping strategies. So self-advocating, communicating what other people need, self-advocating for yourself, communicating to others what you need. That may well be quite difficult, but it also feels really good when you get what you need because you've been able to do that. Connect with other neurodiverse people. The community are able to provide support and understanding in a very deep way. Stimming, we did talk about stimming in the last one. I'm going to stim. It is a way of regulating emotions. Having noise cancelling headphones, weighted blankets, fidget toys, things that help, external things that help manage those oversensory overloads and regulate. Being able to unmask in a environment that you feel safe, even on your own, you know, going and putting a blanket over your head and just lying still and quiet is wonderful. So again, which comes into rest and recharge. Those established routines and boundaries that autistic and neurodiverse people often rely on. Identifying and reducing triggers, retreat to a quiet, low sensory environment, as I just said. Use an energy accounting system, set yourself those limits, and just set reminders for self-care and prioritize that little bit of autistic joy. I have two pictures of two people right next to me because I need them, just because. So yeah, just you can do it in just the most easy way sometimes.
All right, so the next thing we just wanted to talk about was autistic overwhelm and burnout, and just what the slight differences are between the two. So in terms of autistic overwhelm, so the symptoms of sensory overload does vary according to the individual, but some of the common symptoms include a real difficulty on focusing on tasks, extreme irritability, restlessness, the urge to cover your ears and shield your eyes from sensory input, stress, fear, and heightened anxiety, and increased sensitivity to textures or any sort of clothing that might be touching the skin. There's like an increased sort of sensitivity to those feelings. And so responses to overwhelm may include meltdowns, so that's an involuntary loss of control, or shutdown. So that's where someone may become quite unresponsive or difficult to communicate with. Now, overwhelm is often temporary, and it can usually be managed with coping strategies. So like Sammy said, each individual will have their own coping strategies and know sort of how to manage that, when they're sort of feeling overwhelmed. Autistic burnout. So, I mean, this has three primary characteristics. The first one being a pervasive exhaustion. So it's a fatigue that kind of seeps into every aspect of that person's life. A heightened sensitivity to sensory input, and a loss of those essential daily skills. So in terms of executive functioning, like thinking, remembering, and self-care, can all be affected when someone is suffering from burnout. And other symptoms may include low mood, a reduction in being able to use those coping strategies, and emotional dysregulation. Autistic burnout, it can have really acute and long-lasting effects on mental health and well-being, with symptoms often being typically similar to clinical depression. And chronic burnout can exacerbate existing mental health conditions and increase the risk of crisis, according to the National Institutes of Health. So it's really important that if someone is experiencing burnout, that they are able to prioritize their self-care and ask for help. And then on the next slide, we just wanted to talk about the similarities between autistic burnout and a mental health crisis, because there are some similarities. So the first one being difficulties with concentration. So both conditions often present with cognitive challenges like brain fog, and trouble with executive functioning. So being able to think about those daily tasks that everyone usually performs and just really struggling with those daily tasks. Social withdrawal. Social withdrawal is often a symptom of depression, and autistic people often will tend to withdraw more than usual in burnout. An overwhelming sense of emptiness. So depression is often characterized by a deep sense of emptiness. And similarly, in burnout, the inability to engage with autistic joy can lead to a similar feeling, especially when those interests are closely linked with someone's identity. And fatigue and a lack of motivation. So the overwhelming tiredness and lack of drive are really common in both, making even getting out of bed a really difficult task on some days.
So, autistic adults in mental health crisis, we just wanted to talk about some of those statistics. Almost 80% of autistic people will experience poor mental health in their life, and that's the highest of any group. 77% of autistic adults will reach crisis before community support is provided. Autistic people make up approximately 1% of the population, but 11% of suicides. So that, that's overwhelmingly disproportionate number of suicides. Autistic adults with no learning disabilities are 5 times more likely to die by suicide than the general population. So these are just some little life experiences from our network. Sometimes when you call the crisis line, the phone just rings and rings and you have to leave a voicemail. It's really hard to ask verbally for help when you don't know they'll call back, or even if they've received your message. The time we'll be waiting is ambiguous and it can feel like torture. Sometimes they call back and the response feels very patronising. It makes you feel more in crisis, like when they ask if you could make yourself a cup of tea. It really does feel like you're not being listened to. Sometimes I wish the crisis team were more proactive, more akin to emergency services, where they can support with that de-escalation. We need some kind of triage system for the crisis team. Nobody pranks the crisis team, yet sometimes we get a response days later. It could be 3 hours or 3 days, and it can't be left for that long. When somebody's in crisis, you need an emergency dispatch to try to triage that system. And the Samaritans will give you an ETA of response time, so you've got an idea of when you're going to speak to people. That's not the case with the crisis time, and it'd be really helpful.
So this next slide is just thinking about what might help autistic adults in crisis. So as we said, it can be especially hard for autistic people to communicate the concerns relating to their mental health, as it can be really difficult for an autistic person to describe what they're feeling. And there is a potential for mental health issues to be misdiagnosed or overlooked in autistic people due to these communication difficulties. So data collected by the NHS England tells us that there was an increase of 51% in the numbers of autistic inpatients without a learning disability in mental health hospitals between March 2017 and August 2023. Now, safety plans are one strategy for autistic adults to help keep themselves safe. So these plans can be prepared by that person who may be at risk of self-harm or suicide before reaching crisis point. We wanted to talk about attitudes towards autistic people. So many people in our network have struggled with attitudes towards them in health appointments by medical professionals or reception staff. So the views of autistic people are often outdated or stereotyped rather than influenced on an accurate sort of personalized basis. And these stereotypes can often be quite harmful, and they form a generalized view of a minority group of really vulnerable individuals. So there are many examples of autistic portrayals. Some of these may be negative, some may be positive. And the media has a real significant influence on the views of others. So on the next couple of slides, we will have some examples of both negative and positive example of stereotypes, which you may or may not be aware of. But we'd just like you to think about, would you like to be represented like this if you were autistic? And in terms of attitudes, so we just wanted to mention some of the common misconceptions of autism. So the first one being that autism is a mental illness, that all autistic people have a learning disability, that autistic people don't show empathy, that autistic people have special powers, that only males have autism, that autistic people are aggressive and that autistic people endanger themselves and others. And so these misconceptions can really affect the rights that autistic people have to equalise healthcare, and it can really lead to people feeling misunderstood and discriminated against.
So, yeah, so here's some images of how autistic people are sometimes represented, or some famous autistic people that you may know. So we have the good doctor that was mentioned by the group, that actually one of the autistic characters made them feel quite angry. Rain Man, I think we all know the effect of Rain Man. And then we've got Atypical down the bottom there, and two delightful friends, Mr. Wallace and Mr. Musk, who seem to use their autism as an excuse to do bad things. Greg uses the excuse that he's autistic, and the BBC should have investigated that. And Elon Musk, who can very much just do Nazi salutes, and apparently that's okay because he's autistic. So yes, we have a little video from Rain Man, and the perception hasn't really changed of what it's like to be in an autistic crisis. So again, here's some examples of autistic people. We've got and autistic representation. So in the middle there, we've got A Kind of Spark, which is a new CBBC show written by an autistic author with an autistic character, very well presented. We've got Daryl Hannah and Anthony Hopkins, both diagnosed as adults, and Chris Packham, who has done a lot for the understanding of autism in recent years. Yeah, and again, we've got a little video clip in a second, that's gonna show you an example of Chris's advocacy. Next slide.
So following those slides, we just wanted to just have a little think about what's the difference, what's the difference between what might be a stereotypical sort of representation of an autistic person, and then someone talking about their real life autistic experience. So the final slide then is just having to think about what you might take away from all this. So our recommendations, suggestions of reasonable adjustments and challenging common stereotypes around autism. It may help improve accessibility to healthcare for autistic people. So thank you very much for your time.
Thank you so much, Sophie and Sammy. I think we have a mentee now as well at the end. Is that correct?
We do, yes, we should do.
Yes, so let me just let me get that up. Give me 1 second while I close Windows and open another.
That was absolutely fantastic, and I think like the visuals of the presentation is just it's just brilliant, isn't it? And I think everybody was looking at the particularly around the menu, the reasonable adjustments menu, and around the coping strategies. There's quite a lot in the chat around how brilliant those slides were. So thank you so much. There's a few questions as well, but we will get to that after the mentee if that's okay.
So I've just put into the chat the link for Menti, and I'm just typing in the code currently.
Thanks, Angela.
And then I will share my screen as well. 7454705. That's correct. Right, so the code's just come up on the screen now, and you'll see it shared on the screen shortly as well. So I hope people have used Menti before. It's basically just a separate site that we can go to where we can sort of collaborate with one another. Here we go. It should be coming up now. Can everybody see that? Brilliant. We've got people responding already.
Yes.
So we've already got some wanting to share those resources with the team, which obviously exploring energy tracking and management. Like Rihanna said, the reasonable adjustments menu coming up there. Using the digital flags and the passports. The reasonable adjustments menu to save spoons. The co-production, ensuring reasonable adjustments when I see people with autism and sharing resources, researching and understanding, better awareness of what our hospital can do, holistic, adapt those services, there's a lot coming in. Thank you very much.
I think Angela, you're going to attach this to the slides, are you? So everybody can sort of see around what they're going to take away.
Yes, I'll do that.
Brilliant.
I'll share that with everybody so everybody can see the responses that people have made. And just to mention, obviously, we will be going through the chat as well. So if we don't get to everybody's questions, then we'll endeavour to respond as well.
Brilliant. Thanks, Angela. First, is there anybody that would like to put their hand up at all and ask a question?
I have.
Oh, you've got some already, Sammy. Sorry.
Yeah. Do put your hand up, but so we've got, where do we find the autism passports? I know that the National Autistic Society have one. I think the Independent Trust Gloucestershire-based one is on their website. I believe Dorset have also been using one with their young people. Hospital trusts may have their own version. Just use any. Yeah. But there's certainly a National Autistic Society version, so you can, if you feel that that's the one you want to use, it's on their website. Is a similar access suggested for A&E? Yes. I appreciate it's slightly more fast-paced in A&E. Actually, waiting in A&E will be an autistic overwhelm, full stop. It's busy, it's loud, you can be waiting for hours. I appreciate that it may not be that easy to adapt, but yes, any of those circumstances would be good. What's not a good autistic appointment closure look like? Having something very solid to take away, so that the autistic person can process in their own time, maybe with their family member or an advocate, which is why we were saying about that written plan at the end of the appointment, sorry, really does help. Sophie, if you want to come in, that's fine. I'm just rushing through these questions.
Yeah. No, I think you've summed that up really well, Sammy. And it's just having that something to take away after the appointment, like we mentioned, that sort of written plan of action, and having that written down following the appointment can just really help that person remember what was said, because it's so easy to forget what was said in an appointment, especially for someone who is autistic, and so having that written down afterwards can just be really helpful.
So has anybody heard of any change or improvement with crisis calling of 111 option 2? No. I didn't even know we could do that. We certainly haven't had any feedback on that from the group. It's something we can take back to the group, unless it's in the chat. Now, this is a really good question, and it did come up in the network. So how do we share in terms of representation, how do we share the experiences of those who are AME? And that's really interesting. There's even less representation for autistic people of being AME, as there is of autistic queer people. We can then get into the minorities within the minority. I think don't resort to stereotypes as well. You may not know their stereotypes. But yeah, Sophie, I can't remember what the network said.
No, I'm trying to remember what the, because we haven't specifically covered that exactly. Yeah, sorry, I haven't really got much more to contribute on
Yeah,
that.
no,
that
it's
question.
really difficult. And maybe that's something that we need to take back to the group ourselves. To talk about that a little bit more. Leona, I think that's all the questions I have. Do you have any more?
Oh, let's have a, is there anybody that would like to put their hand up at all? Just while I'm going back through the last few messages.
So can the reasonable adjustment flag only be put in place if somebody has an official diagnosis? I believe that it is for anybody who needs reasonable adjustments, whether that is language. Leona, do you know a little bit more about this? Because I know
So helpfully, people have shared quite a lot in the chat. So there are a few links in there. It is still within the early stages of being rolled out. So I haven't got anything further to add apart from have a look through some of the links that people have put in, because I've had a look myself and there's a lot of detail in there. But yeah, you're right, no diagnosis is needed for the flag. Is that why you've got your hand up? Sorry, Patricia?
Yes, it is. You don't need a diagnosis. Just to confirm,
Yeah.
you don't need a diagnosis.
No, it's any reasonable adjustments you may require. But there's some great links in the chat for people to look at. I know there's quite a lot of questions around that when you put your slide up.
So this again is the flag about the flag is the reasonable adjustment flag being adopted across the NHS. It should be. I know it's been in pilot stage. I know it's been talked about being adopted across the NHS. I suspect the answers are in those links again.
Brilliant. Sammy and Sophie, I think we are just coming to 2 p.m. We've still got quite a few questions in the chat, but we will get to them. And if there's any that we don't get to, please feel free to send it through to our email address, which I will pop in there too. And it has been absolutely amazing. I think it's been so powerful. Everybody's written in the chat. You'll be able to look through, Sammy and Sophie, just how powerful it has been for people. And I think we're all very excited for the next one, which everybody will get an email about soon. So thank you all so much for joining.
Thank you. Thank you, everyone.
Thank you. Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
You said thank you for your time and expertise.
Thank you.
Thank you, Sammy.
Thank you.
It's lovely to hear everybody's thank yous.
I've never heard so many thank yous. It's the loveliest
Thank
thing.
you very much.
Oh,
It's like when my children play Fortnite, and then when you get off the bus at the beginning, everyone says thank you at the start. Anyway,
Hello,
Sammy, that was brilliant. That was absolutely brilliant, and Sophie as well. Lovely to meet you.
I agree.